Access to quality health services is a human right. In fact, it should be non-discriminatory, physically and economically accessible, among others. However, as drugs become easier to access, the easier it becomes for them to be abused and misused. Nowadays, some people find it easy to purchase drugs and go ahead to use them, or even for their family members without prescription.
I always do self-medication because most of the times there are some sicknesses like maybe you get an headache, just have to rush to the nearby pharmacy and get some medicine.
Every time I go to the hospital, I'm not getting anything different from them. They will give you the same medicine. So when you tell them I want this, they will be like, you're not a doctor. You don't need to advise us on what to do.
To understand better the effects of self-medication, we talked to Dr. Joseph Mutiaba. He is a senior medical officer at Lifelink Hospital.
When you go pick your medicine, you don't know if this medicine is really going to work on this bug. So you're at risk of making this bug resistant. 2, you're worsening the situation if the drug is not working. 3, if you actually pick a medicine which is going to make your organs fail, like the kidneys, like the liver. Someone was given a dose as an adult, but since they were told to take 2 times 3, when the child falls sick, they carry the same 2 times 3 and give the child, because this is how the doctor gave me the medicine. So you can see putting the innocent person into risk. The organs can fail because of the overdose and all these things. Now, you've taken this medicine. It has not worked. You're becoming worse. Who's going to give the information about you? You will die.
Dr. Mutiaba explains further that prescriptions follow lab investigations and other professional considerations, including weight, age, severity of the disease, among others.
If you give a correct drug, but in a low dose, you're calling for this bacteria to get resistant to this drug. If you give a right drug, but not in the right duration and everything, you may cause this bacteria to mutate and actually become resistant.
You may not care about your neighbor misusing drugs or self-medicating, but the ripple effects will affect you fairly and squarely.
But here, you may find people can go to a pharmacy. If this pharmacy refuses, the other one can accept. So the issue of us getting medicines ourselves, it may not be now, but in the future. Because now if given a medicine, it has not worked, all the bacteria in your body have become resistant, then you're going to spread these bacteria to other people. They will get the same bacteria, which is very resistant. Getting the medicine to work on it, it becomes hard. Someone gets a UTI, as simple as it is, it quickly gets into a urosepsis, and then he dies because the bacteria cannot be treated by any available antibiotics.
So, should we blame the pharmacists? Winnie Nambatia, a member of the Pharmaceutical Society of Uganda, says this problem is much bigger than mere pharmacists, but more of the health system.
We'll have to take baby steps and then maybe take the lowest hanging fruit, like our professional bodies working together first, and then thinking about those communities that have no access to healthcare facilities. How can pharmacies be of help? So it may be a challenge for a setting like ours, but the lowest hanging fruits are always there, and they always come from collaborations between the professional bodies.
In her opinion, she has seen some interventions work in other countries like Rwanda that has a national health insurance scheme.
Through universal health coverage, we'll think about ways of how the people in the localities without access to healthcare facilities can benefit through pharmacies. There are some countries where pharmacists have gone through some particular trainings and they are certified prescribers. So those are monitored. So every prescription has to be monitored or verified by the closest, maybe regional referral hospital doctor that has been attached to that pharmacy.
According to the World Health Organization, about 275 million people aged 15 to 64 years used drugs at least once in 2019. About 36.3 million people suffered from drug use disorders in the same year. Walter Mwesije, NTV.